MR guided VAC, which is a very advanced procedure, but it brings certainty to women's cancer care. Now, I hope by the end of my presentation, I'm able to explain the significance of this advanced technique and how it bridges the gap in early cancer detection. And it's no more a medical jargon for you, but you understand the significance of it. So we all know about breast cancer. It's the leading cancer in the country. The cancer burden is about 27 to 28% in the women who have cancer. It is curable if caught early. Now, if you see the mortality or the death rates of cancer in our country, for every 2 newly detected breast cancer, 1 is dying of cancer. Whereas in the West, for every 5 to 6 patients that are newly detected with breast cancer, only 1 is dying. So there is obviously a mismatch in the mortality rates, and they are doing something better than us, that they are able to control their death rates. So let's see what exactly the difference is. We all know early detection saves life, and the survival rates are more than 100% if we catch cancer early. But many Indian women, they are diagnosed late, and many a times even those who are getting routine scans, they are also diagnosed late. One of the major issues is that in our country, the breast cancer is seen at least a decade earlier than compared to the West, which means the peak age is when the breast tissue is very dense. So dense breast tissue hide tumors on mammograms and ultrasound, the routine test that we do for breast cancer. This results in delays in much larger complicated surgeries, very aggressive treatments, and more emotional and financial strain to the patient. So that we have this narrative of catch the cancer early, but how can we if we can't see it? Now, just to explain what I mean when I say dense, this is the mammogram of a patient who is premenopausal. So all that white tissue that you are seeing is actually her breast tissue or her milk tissue. Now, the cancer is also seen white, and a white tissue against the background of white can be easily hidden. So this
20th of January, and I've already seen 12 patients under the age of 40. That is very, very alarming. And sometimes you think कि इनको क्या बता सकते थे जिससे कि ये चीज को जल्दी पकड़ लेते. It is very tough to kind of get your head around these women. They say, I'm healthy, I do all the right things, exercise.
I'm getting my screening also done, but still.
But the screening for the 30 to 40 is very, very blurred still. But I think that is where an MRI comes into play, because if you have a dense breast, your mammogram is not going to tell you anything. Sometimes ultrasounds also miss it, and ultrasounds miss it because it is the person behind the machine, how you do it. It's dependent upon, it is operator dependent. So there is a probability that you may miss, आप उस कैंसर को मिस कर सकते हैं. तो ये जो 30 से 40 वाले ना, ये तो हमें बड़ा दिल दहलाते हैं हमारा. लेकिन पर मुझे लगता है कि कहीं कहीं अगर हमें थोड़ा सा भी लगता है कि ये चीज़ सही नहीं है, अल्ट्रासाउंड पे या हमें हाथ लगा के भी कुछ लगता है कि राइट नहीं लग रहा है, आई थिंक वी शुड गेट टू द नेक्स्ट स्टेप, एंड दैट इज एन MRI. और MRI से हमें कई बार ऐसी इन्फॉर्मेशन मिलती है जो बहुत ही सरप्राइजिंग होती है. आप एक ब्रेस्ट को देख रहे थे, पता चले कि दूसरे ब्रेस्ट में भी है, तो ये भी होता है. सो वी आर सीइंग अ लॉट ऑफ बायलैटरल ब्रेस्ट कैंसर्स, एंड आई थिंक दैट इज हाउ एन MRI कम्स टू हेल्प. और जैसे मैंने कहा कि दूसरे ब्रेस्ट में भी दिख रहा है लेकिन फील नहीं हो रहा, आई कांट फील इट, but she can see on the MRI that there is something in the opposite breast also, and that is when she says that she wants to do a biopsy of the opposite breast. And so many times we have found cancer in the opposite breast. We were planning to operate on one side and we'll end up operating both sides. So this is not an uncommon situation. I would say not very common, but I think the assessment of the opposite breast also becomes very, very important. And with young breasts, it's a huge challenge. And
like we went through all the treatment, and after her treatment, I was advised by the doctors to have routine and follow-up checkups. And before that, I also had undergone the genetic testing, and in the genetic testing, it came out that I had the same genetic mutation. So I was recommended routine tests so that I can be supervised and guided if for precaution basis. And so in one of the precautionary MRI scans, there was some unusual growth in my right breast. So I was recommended MRI guided VAB. So we went through the MRI guided VAB, and fortunately it came out to be benign. It was a very small procedure and the results came within 3 to 4 days. But the wait was more difficult than the whole procedure, and especially for my parents who had already seen one of their daughters undergo the whole treatment. So it kind of really helped my parents and my family to reduce their uncertainty anxiety. So I would really urge anyone who has a similar detection as mine to undergo VAB if they are recommended that, because it definitely reduces delays and it gives a peace of mind apart from the precision and accuracy because of the latest technology. Thank you.
The reasons behind such low rates of breast cancer screening are many, and first and foremost is lack of awareness. लोगों को पता ही नहीं है कि स्क्रीनिंग टेस्ट भी होता है जो कैंसर को सिम्टम आने से पहले ही पकड़ सकता है. सो स्क्रीनिंग टेस्ट वो टेस्ट होता है जो हम एसिम्टोमेटिक इंडिविजुअल्स को ऑफर करते हैं. नॉर्मल लेडीज हु डू नॉट हैव any palpable lump, who do not have any apparent skin changes, who have no lump in the armpit, they are being tested to see if they have early stage of cancer in their breast. So screening test के बारे में awareness नहीं होना. Lack of awareness is the single most important factor. The other factor is that it is not even available. It is not even accessible. There are very few centers in India where even a mammogram is available. If we go beyond the metropolitan cities, most of the India which is residing in the urban, in the rural areas, or even in tier 3 cities, the mammography units is not available everywhere. There we don't have experts. Here we have a leading radiologist talking to us about this advanced technique, but we do not yet have a radiologist who's trained enough to read a mammogram, isn't it?
But
so that's
you
another.
are lucky. You are in.
Yeah,
in
we are lucky.
Delhi.
We are really
So,
fortunate. And
in a place like this, what's the challenge that you face?
so here there's another type of challenge now. So we in India see many young breast cancer patients. So almost 25% of breast cancer patients in India are less than 40 years of age. And when the person is young, the breasts are dense. And if to these women we offer only a mammogram or an ultrasound, we are very likely to miss exactly those types of lesions that Dr. Jyoti Arora showed us. So for those subset of patients, and herein we have to identify that subset, those with dense breasts, those who have strong family history of breast cancer or other related cancers, those who are carrying an altered gene like BRCA or similar high-risk cancer genes, they are the ones who should definitely be offered such a test so that they can benefit, they can get diagnosed in stage 1. So
Now,
that's where the beauty of this test lies. Yes.
For the support, for being here, and I would like to thank our amazing clinicians for being part of this dream and this vision, because if it isn't for them, I don't think we'd all be standing here. I would be standing here and all of you in this room with me listening to what we've done. It is meaningful to come together because moments like this are actually historic. And in healthcare, progress really does not mean about adding technology. Technology is only one part of progress in healthcare. It's about closing the gaps in care, and we have spoken about it, but I know that there's a long road ahead. It's about reducing uncertainty. Especially in cancer, there is more uncertainty, and the certainty which we hear is actually quite scary. So if we can really flip that coin and make it better, it will be a job well done. And it's about giving patients the comfort of knowing that the best is available. And I think that is a commitment from the group, that whatever is the best in care, whether it is proton, or if it's a VAP, or if it's a procedure, great surgical, precision oncology skills, we should be able to give the best to the patients, to the people of our country who trust us, and we need to do it unstintingly. And I think that's what's been special about the Apollo group. It's actually just 4 months that we inaugurated Apollo Athenaa as Asia's first dedicated women's cancer care center. And the journey has been exciting. It has been rewarding. Small wins, but significant wins. And at this point, I'd really like to thank Priyanjali, who's joined us here, and the other patient's son, because it's not always that people come forward to talk about the trauma they have been through, and really be a torchbearer for the rest who may need this kind of care. So thank you for doing that for us. And I hope listening to you, a lot of people, their lives are saved. So I think what you've done is great. Our teams, of course, have worked with a very quiet urgency, I must say, that they really are people of substance, because Samarth is also here, so I can't even say women of substance. But having said that, I think they're a team of substance and a deep sense of purpose, and that is really translated into the vision becoming reality. At this point, I must also acknowledge the management team, which is, Shadu and John and all these beautiful young girls who really do much more than what is expected of them. So I think the team's been phenomenal. But what we've been able to do is to bring this technology to the center. And VAB is not something which is common. Only the best and the largest centers even attempt to do it. And doing it in a center which is barely 4 months old, I think is significant. It just proves the fact that, we want to make a difference and we want to bring the best in class. We also are committed to expanding this vision forward in different formats. I think Apollo Athenaa, as I was sharing with one of our team members, Apollo is the Greek god of medicine. And it was my sister Sunita, when we first started Apollo 42 years ago, one of the names which came up was Sushruth. And as a family, we just moved back from the US, and she told our chairman, she said, what a difficult word, I can't pronounce it. And we should be international, we should really signify what is global. So then, of course, chairman said, okay, what do you want to do? And so she said, can we call it Apollo, which is the Greek god of medicine, and it's also the sun god. And it just seemed like, very significant. So we did that. And at the same time, Apollo landed on the moon. So it was like, a good shagun. It was something which was good and significant for us. And we all love the name. Everyone who works at Apollo loves the name. But when we started on Athenaa, I was trying to figure out, again, a name which is global, which has some significance. And I was thinking about it, talking to one of our doctors in the night, and he's 9 now, but my 7-year-old grandson said, Mama, why don't you call it Athenaa? It works very well with Apollo. And I thought, oh wow, what a great idea. And then I took it to our chairman, and he said, that's fantastic, because we have the Greek god of medicine. And we have Athenaa, who's actually a warrior goddess. She's the Greek god of war. So she fights battles, she looks fabulous, and she's a winner all the time. And that's what we want for the women in our country, for the women globally, that they should be able to fight their battles, come out strong, look gorgeous, because they're meant to look fabulous. And for everyone else to see that, women's health is so important to us. I also want to mention that, there is not enough focus on women's health. And it is not only a significant fact in India, but globally it is an issue that, not enough focus is happening on women's health. It's beginning, but it's not enough. And that is why doing this center for women's cancer, for women's health, is very meaningful to the Apollo group. Because we want to do this because we really mean and we want to make a difference. We want to raise the bar on awareness. And it is the promise that whatever is best in class globally, but whatever is best in class which can be developed in India. And I think today research, newer technologies, better ways of doing it, integrative medicine, like, Jyoti is now doing a research project with Ayurved, trying to see can we do something better. So I think as a country, we have to be torchbearers. We have to be torchbearers for the rest of the world to say that India means business. So while we do become the third largest economy globally, which will happen, we will also become a front runner for healthcare and medicine. And I think that will be the true vision and the true dream of all of us who are here today. So thank you very much for your time. God bless the team, and I'm sure that this is just the beginning. We're very young, we're only 4 months old, and in 4 months they've done a fabulous job, and there is so much more to be done. Thank you.